What is the difference between a manifestation and a comorbidity? A manifestation is a second condition caused by the first condition. Let's use diabetes as an example. Diabetes is known to cause problems with the patient's eyes. The physician diagnoses the patient with diabetic retinopathy. The diabetes caused the retinopathy. You will have two codes to report: code for the diabetes and a code for the retinopathy. The diabetes code will be reported first because it is the underlying or first condition. A comorbidity is a condition that is active in the same body at the same time as another condition. However, there is no relationship between these two conditions, no cause and effect. So, for example, our diabetic patient fell and broke his leg. So, the diabetes and the fracture are comorbidities. They are two conditions present in the same patient at the same time. Which code will you report first? The code that is the reason for the encounter with the physician. So if you're coding for an orthopedist and the patient is here for a follow-up on the healing fracture, the fracture will be reported first. The diabetes will also be reported after the fracture code because diabetes is a systematic condition that this physician must take into consideration during the process of caring for this patient because the diabetes will impact the treatment plan. Another different example of a comorbidity is patient's history includes asthma. She is here to see the dermatologist to have a benign mole removed from her arm. This physician does not ask about her asthma. The asthma does not have anything to do with or no relationship at all to the benign mole or the care treatment of the mole. You will only determine the correct diagnosis code for the benign mole. The asthma is not to be reported at all. Another different example of a comorbidity, patient's history includes asthma. Okay. She is here to see her family physician for her annual checkup. The physician asks her about her asthma and writes a prescription for a refill for her inhaler. In addition to the annual physical diagnosis code, you will also need to report the asthma because the physician paid attention to it during this encounter. You have any questions? Please ask your instructor. Use either the email or the Q&A discussion in the discussion forum.